Welcome back. I'm Dr. Jackson, board certified urogynecologist, and today we're talking about a topic that I think doesn't get nearly enough attention, and that's your heart and estrogen's effect on it both before and after menopause. Listen in. Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristin Jackson. Every week, I share my over 25 years' experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us. So listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. I know you're already familiar with estrogen and its positive effects on hot flashes, night sweats, and mood swings. But most women don't know about its powerful effects on the cardiovascular system. Heart disease is one of the most under-recognized health risks for women, especially women in menopause. So let's get into how estrogen affects your heart. Estrogen acts as a vasodilator, meaning it helps your blood vessels to relax and open up, allowing better blood flow. It also helps to reduce plaques in your arteries by reducing LDL, cholesterol, and reducing vascular inflammation. That's inflammation inside the lining of your blood vessels. So in short, estrogen protects your arteries. So when estrogen decline happens at menopause, you lose that natural protection. This is one of the reasons why women's risk for heart disease dramatically increases during and after menopause. And the impact is enormous. Over 60 million women, that's 44% of women in the United States, are living with some form of heart disease. And most worrisome for me is that it's the leading cause of death in women in the United States, responsible for over 1 in 5 deaths of women in 2023. That's as recent as our statistics go. That's about 1 in every 5 female deaths. Yet, only half of women actually recognize that heart disease is likely your number one killer. If I ask women what they are most fearful of getting as they age or dying from as they age, the answer is almost invariably breast cancer. Because when I talk to women about heart disease, it seems a little amorphous. What does that mean? Whereas when I talk about breast cancer, women immediately perk up, they get nervous, they start telling me stories about someone in their family or someone in their life that they know was diagnosed with breast cancer or died from breast cancer. There is a much bigger fear about breast cancer in women than there is heart disease. And it's not that we shouldn't be fearful of breast cancer or take steps to prevent it. However, if you want to do something positive for your health and that's going to improve your longevity, you've got to play the odds. You need to attack the diseases that are going to make the most impact for your health. And reducing your risk for cardiovascular disease makes a huge impact in women's health. So let's compare the numbers. I'm going to check my notes here so I get the stats right. Over 60 million women live with heart disease. And in 2025, there were just under 280,000 women diagnosed with breast cancer. That's 60 million women with heart disease versus 280,000 with breast cancer. And heart disease causes over 300,000 deaths in women versus just over 42,000 deaths from breast cancer. So this is why I say you've got to play the numbers. If you're looking to improve your longevity and improve your health as you age, taking steps to ensure your cardiovascular health are going to have the biggest impact. So, of course, I want women to screen for breast cancer and take the appropriate steps to reduce their breast cancer risk. But today, we're talking about the impact of cardiovascular health because it's a much bigger fish to fry. So when we're talking about heart disease, let's really define what that is. We're really talking about heart attacks and strokes. And heart disease develops because plaques build up in our blood vessels. When we talk about plaque buildup, we often think about plaque building up in the vessels serving our heart. But remember that our vascular system, our blood vessels, travel throughout the entire body. So if plaque builds up in the coronary arteries, the arteries that bring blood to the heart, it can cause a heart attack, where part of the heart muscle dies. If plaque builds up in the blood vessels to the brain, it can lead to a stroke, where a portion of the brain does not get blood flow for a period of time. That can lead to weakness on one side of the body, difficulties with speech, difficulties with memory, difficulties with motor skills. If plaque builds up in the blood vessels to the kidneys, it can lead to kidney disease and kidney failure. So I could go on to any organ in the body. If plaque builds up in the vessels serving an organ, that organ may suffer and may no longer function. So cardiovascular disease is not just about one organ, your heart. It's a full body issue. And estrogen affects the entire system. So we all have a heart. We all have blood vessels. That means we're all at risk for cardiovascular disease as we age. So one of the most important questions I ask in my clinic is, has anyone in your family had a heart attack or stroke before age 50? We know that plaque development in the arteries is an age-related disease. So people who have a heart attack or stroke in their 70s or 80s are most likely to have had plaque buildup over a lifetime. And finally, in the decade of their 70s or 80s, it reached a critical level where the blood flow to an organ was compromised. But if you have a first-degree relative, that means a mom, a dad, a sibling, or a child who had one of these conditions under age 50, that can be a red flag for a genetic risk of plaque buildup, not just an age-related risk. So for someone in their 70s or 80s who've developed plaques and possibly a heart attack or stroke, that is an end result of an accumulation of a lifetime of risk factors, things like smoking, sedentary lifestyle, obesity, high cholesterol, diabetes, and a poor diet. So having a relative who had a stroke or heart attack in their 70s or 80s doesn't translate into as much risk for you personally as compared to a family member who had a heart attack or stroke under age 50. In that case, the risk to you personally might be elevated. So the 5 big primary cardiovascular risk factors are smoking, diabetes, high blood pressure, high cholesterol, and that family history of a young first-degree relative with a heart attack or stroke, like I just described. And having even one of these risk factors significantly increases your personal risk for cardiovascular disease. There are also some secondary risk factors that might be less well recognized. Obesity, especially central obesity, where you have increased visceral fat around your organs, more on that in a moment, and a history of chest radiation or chemotherapy. Radiation to your chest can cause damage to the heart, especially the valves, and it can show up years later after you've finished your chemo or radiation. The radiation specifically can thicken and stiffen the heart valves so that many years later, the heart valves no longer function, and often they may need to be replaced. Plus, the Menopause Society has even listed reproductive risk factors that lead to a higher risk of heart disease as women age. I want to go through these one by one because this information is generally new. It's definitely not out there in the general population. And even your provider may not recognize these risk factors if, unlike me, they're not reading every piece of information regarding menopause medicine that there is. So the first reproductive risk factor relates to timing. If you started your period early, less than 10 years old, or you experience an early menopause, less than 40 years old, that translates into an increased cardiovascular risk. The next is polycystic ovarian syndrome, or PCOS. This is a condition that reproductive age women have, and it's associated with missing or skipping periods, increased androgens, increased hair growth, and sometimes difficulty with conceiving babies. PCOS is associated with a 30% increased risk of cardiovascular disease, including heart attacks and strokes. So the symptoms of PCOS generally end with menopause, because if you're having abnormalities with your periods, after menopause, you no longer see that. You don't have a period anymore. If you're having difficulties with infertility after menopause, that's no longer an issue. But the risk to your heart for having had PCOS persists for the remainder of your life. I think PCOS is a poorly named syndrome. It was called polycystic ovarian syndrome because back in the 40s, it was the abnormal look to the ovaries on ultrasound that researchers first saw. So they named it polycystic ovarian syndrome because they saw all these tiny little cysts in the ovary. But that name makes it sound like the ovary is at fault, like the ovary is doing something wrong, causing this syndrome. In actuality, PCOS is a metabolic condition of disrupted hormones, specifically androgens and insulin. So if we had named it something else, like abnormal metabolic syndrome, it would make much more sense that PCOS translates into a lifetime of increased cardiovascular risk. But calling it an ovarian syndrome makes it sound very localized, like it's something that just affects the ovaries and doesn't have any effect after menopause. So I think the naming of that really can trip some people up. The next reproductive risk factor has to do with how many children you have. The highest cardiovascular risks are associated with women who've either had 0 children or given birth more than 5 times. So having between 1 and 4 children is actually protective to your heart, whereas having 0 or more than 5 children is actually an increased risk to the heart. And what happens to your blood pressure during pregnancy also has lifelong results. Hypertensive disorders of pregnancy are now recognized as an independent risk factor for cardiovascular disease. This might be things like preeclampsia or eclampsia or gestational hypertension. And gestational diabetes, that's diabetes that just develops while you're pregnant, is also an independent risk factor for your heart. Plus, gestational diabetes gives you the added bonus of giving you a 7-fold increased risk for diabetes for the rest of your life. So gestational diabetes really gives women a double whammy on that one. And drum roll, please, I feel like I saved the best and the most shocking for last. Persistent or severe vasomotor symptoms, these are hot flashes and night sweats, are associated with a 28% increased risk of heart disease. This information is insane. Vasomotor symptoms are associated with body inflammation, and we know that inflammation of the blood vessels increases plaque formation. So with every hot flash and every night sweat, women are increasing their cardiovascular risk. For this reason alone, this is a great reason for women with symptomatic menopause to treat with hormones or with other medications that decrease their hot flashes and night sweats just to protect their hearts. It's actually kind of amazing to me that cardiologists have not taken this information and tried to do a better job educating their patients with symptomatic menopause that this is negatively affecting their heart. So the old information we used to give women who had hot flashes and night sweats of just tough it out, hang in there, wait for the hot flashes to go away. Sure, that's one way to do it, but we are exposing those women to higher rates of heart disease, the #1 killer as they age, rather than treating it and protecting their hearts and reducing their risks. All right, so those risk factors may sound a little bit defeating because you don't have control over most of the risk factors I discussed. You don't get to pick when your first period starts or when your periods end. You don't get to pick whether you have preeclampsia or gestational diabetes. Probably the only risk factor you have control over is the number of children you choose to have. But if you do choose to have children, there is a lifestyle change that can be protective to your heart, and that's breastfeeding. Breastfeeding reduces a woman's risk for heart disease, and the longer you breastfeed, the better the risk reduction. Breastfeeding has also been associated with lower risks of hypertension, diabetes, and obesity for the breastfeeding mom. So if we add this to the very long list of benefits that babies get from breastfeeding, moms also get a huge health boost by breastfeeding their babies. So let's move on to talk about something else important. And I mentioned this before, but it's central obesity. Fat distribution matters. I don't know if it's used as much today, but when I was growing up, women were described as apple-shaped or pear-shaped. An apple-shaped woman carried most of her weight around her middle, like a spare tire around the center, whereas a pear-shaped woman carried more of her weight in her hips and bottom, but she had more of a waist that you could see. Now, while I don't care to characterize women as various pieces of fruit, the distribution of fat around your body has important implications for the health of your heart. Visceral fat, that's the fat stored in your middle around your organs, is strongly linked to cardiovascular risk. It creates inflammation, worsens your insulin resistance, and stresses out your vascular system. So people with that apple shape tend to have more visceral fat, and that means they're going to have more inflammation, more diabetes, more risk for heart disease, and also more types of several different cancers. And this is why, if you're trying to look at your weight in relation to your health, using something like your BMI or body mass index is not always the best measure. Your BMI looks at your weight in relation to your height, but it doesn't take your fat distribution into account. A better measure might be your waist to hip ratio. This is a measurement right around your waist in inches divided by the same measurement right around your hips. In women, a waist to hip ratio that is less than 0.8 has better heart outcomes as compared to a measurement that's greater than 0.86. Those numbers are a little bit higher for men, but the healthiest waist to hip ratio in men is one that is less than 0.9, with men's heart risk increasing when their waist to hip ratio is greater than 1.0. So yes, weight is important, but where you carry that weight may be even more important when we're talking about your heart health. The most common patient I see in my longevity practice is a woman between the ages of 45 and 65, and she's usually saying that she may want to start hormones to improve her health. So maybe this is you. Maybe you feel your hormones are off, or maybe you have a friend who started hormone replacement therapy and feels amazing. So you may come to me asking, am I a good candidate for hormone replacement therapy? But this is not where I start. I want to take a step back and look at your entire lifestyle to help you not just live longer, but feel amazing, look amazing, and have amazing health as you age. And looking for and screening for cardiovascular disease and helping you to reduce that risk is one of the most important steps we'll take. So I start by taking a full medical history and asking you about all the risk factors we just discussed. I want to know if anyone in your family had cardiovascular disease, especially younger in life. And I want to know your baseline vital signs, especially your blood pressure and some baseline lab values like your cholesterol and your fasting glucose. Putting all this information together will give me an idea of whether you are at low, medium, or high risk for heart disease. For women who end up in that high risk category, they may want to consider some additional screening tests. You may think about a baseline stress test to see how your heart performs, or even a coronary calcium screen. But if you're in this higher category for heart disease, I usually am going to have you work with a cardiologist to make sure that you get the best care. But many of my women are going to end up in the low to medium risk for heart disease. They don't need immediate intervention for their heart now, but I want to help them keep their heart healthy as they age. So what might I recommend if that pertains to you? It always starts with the basics. Movement, diet, modify your risk factors that you have control over, and consider hormone replacement therapy. These 4 things are the basic things that every single woman can be doing to reduce her cardiovascular risk. So what kind of movement are we talking about? You have got to move to keep your heart healthy. Humans were not designed for sedentary lifestyle, but unfortunately, that's what our world has kind of evolved to now. We spend long hours at our desk in front of the computer or with very minimally sedentary lifestyles. So how much exercise do we actually need for heart health? Well, for a baseline, consider 10,000 steps per day, although there are some studies saying that even 8,000 steps per day is good for heart health. Some patients, of course, use some sort of a fitness tracker or their Apple Watch to look at their daily steps. But even little things you can do, like taking the stairs instead of the elevator, or parking further away from the store so you get more steps in and out of the grocery store, all of these little things add up throughout the day to increase your steps and increase your cardio protection. There's also a small study from 2024 showing that 10 body weight squats done every 45 minutes during a normal workday had the same cardioprotective effects as a 30-minute walk. So this is something so easy that you can incorporate to your day. Set a timer on your phone and at least once an hour stand up and do 10 body weight squats, or do 10 wall push-ups, or 10 calf raises. Do something to get your body moving so you're not staying in that sedentary position for too long. This is something I started doing, especially when I'm seeing patients in my clinic. Now, I know I'm often jumping up and down and going to different rooms to see my patients, but I have a reminder that goes off every hour to remind me to do 10 bodyweight squats or 10 wall push-ups, just so I keep moving throughout my day. Because if you're like me, you get into your work, you get into your computer, you get into whatever you're doing, and time just flies. You forget that you've been sitting for 3 hours straight. But movement like that is not the same as muscle conditioning. Muscle is absolutely our body armor as we age. So doing resistance exercises that not only build our muscle, but raise our heart rate is critical for so many things, including our heart health. So the general guideline is 150 minutes of exercise weekly that raises your heart rate to the target range. So this is not just light exercise. You've got to feel your heart pumping to get the cardiovascular benefits. So if you want to get into how high should your heart rate be during your exercise session, your target heart rate is 220 minus your age. And you want to be working at about 90% of that level. So if you don't want to do math in your head while you're listening, for an average 50-year-old person, 220 minus 50 is 170. You want to be working at 90% of that, which is a heart rate of about 150. So just use this as a general guideline, and you can see that your target heart rate will decrease as you age. But the key here really is that exercise should be activity harder than your normal day-to-day life. The next category is diet, and here I like to keep it so simple for people, because there's always new diets popping up, like raw foods and keto and intermittent fasting. But the Mediterranean diet remains one of the most heart-healthy ways to eat, and this has been shown over and over again in research studies. Lean protein, like chicken or fish, olive oil, plenty of fruits and vegetables, and minimal processed foods. So don't overthink it. Just eat real foods, mostly plant-based protein, and lots of vegetables. And I'm not saying that there are not benefits to other diets. It's just sometimes difficult to keep up with all of them, and sometimes you don't know if the diets actually have the data behind them. So what about intermittent fasting? I get asked this question quite a bit. While it may not be better for your heart specifically, studies have shown that people who consume the same number of calories just in a shorter time frame during the day lose more weight than those who consume the same number of calories just spread out through a longer time of the day. So weight loss in general is always good for your heart. It means less risk for diabetes, less inflammation, and therefore a lighter load for your heart. So whereas intermittent fasting may not specifically be a heart-healthy diet, the results of intermittent fasting may be helpful for your heart. Next, we want to modify whatever risk factors we can. So we talked a lot about risk factors that we have no control over, especially those related to the timing of your period and your pregnancies. But let's focus on the ones that we can modify. Keeping your weight at a healthy range, especially looking at that waist to hip ratio, so we're not getting too much visceral fat or central obesity. Stopping smoking, that probably has the most impact, not just for your heart, but for every single disease. I teach medical students, and one of the things I tell them on day one is that when any of their preceptors ask them, what is a risk factor for this disease? Say smoking first, and you're right, almost always. And finally, manage your blood pressure and your cholesterol. And blood pressure and cholesterol are some of the basic things that your doctor should be checking at minimum once a year. Finally, once we've looked at all of these lifestyle factors, we're going to consider hormone replacement therapy for a perimenopausal or menopausal woman. And in my opinion, hormone replacement therapy is one of the most positively impactful things that women can do to reduce their heart risk as they age. So not only does HRT help you feel better today by reducing your hot flashes and night sweats, which we already talked about, they in and of themselves increase your risk for heart disease, but they improve your brain fog and improve your concentration and memory. They help you to sleep better. They calm depression and anxiety. And now here we are talking about long-term, they have protective effects, not only on your heart, but also your bones and your brain. While heart disease is the #1 killer of women, we're still not having enough conversations about it. Estrogen matters, lifestyle matters, movement matters, diet matters. It's never just one thing in isolation. And the earlier we pay attention, the better the long-term outcomes. So don't think about trying to overhaul your life overnight. If you're in midlife, this is absolutely your window of opportunity to start to make some positive changes. Know your numbers, move your body, nourish your body properly. And yes, talk to your provider about hormone replacement therapy if it's appropriate. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.